Welcome, I'm Jess Gomez from the Intermountain Medical Center Heart Institute in Salt Lake City, joined by my colleague Viet, who is a physician assistant and a researcher with the Heart Institute. And you have some exciting research that was presented at ACC 18 that we want to talk a little bit about. Tell us about your study, which involved PET-CT scans.
That's right. Thanks, Jess. With PET-CT, it's a stress test that's functional, and so if you think of it like treadmill testing, etc., we're using myocardial perfusion imaging. It's nuclear imaging, but alongside the PET-CT is, well, the CT. We get a coronary calcium scan. Now, it's not quantified, but it's visual, and when you get a sense of whether there's an absence or presence of coronary calcium, it actually predicts quite well how the outcomes will be in 1 to 2 years after that stress test is done.
Tell us about the study. What are some of the findings that you found? And tell us a little bit about the methodology of the study.
Right. So really, these are all patients from Intermountain, and we have a PET-CT here at the center, and we looked at over 8,000 patients at Intermountain. So in looking at all of these consecutive patients, we looked at whether or not there was coronary calcium or not. And when you do that and you stratify patients to whether they have calcium or no, within the first 60 days, they either, of course, have a revascularization, which means they get a stent or bypass, and or angioplasty and medical therapy, or they have an event, such as a heart attack. We then looked past that point to see long-term whether or not that coronary calcium predicted events. In doing so, the findings were that if you had visual calcium, you were more likely to have coronary angiography in the first place, going to the cath lab, then you were more likely to have revascularization, so stent or bypass, and or you were more likely to have an event, such as a heart attack, and worse, death. Both in the 60-day time frame as well as going long-term.
So as a clinician, what is the takeaway for you?
So the takeaway for me is, this is the exciting part, is coronary calcium itself. As you look at it, you will be able to begin to understand whether or not one needs to go on to a stress test, but also who, when they have a stress test, needs follow-up on a more aggressive standpoint. So it helps to determine treatment.
So from a diagnostic standpoint, tell us what you feel about the findings. How are these going to help you as a clinician, and how will they help moving forward?
Yeah, so in the current day, I'm going to look at coronary calcium. Whenever I get a stress test back, I'm going to look to see whether it was absent or present, and for those patients that have coronary calcium present on their scans, I am going to direct my attention to them much more thoroughly.
Okay. Why have we not used PET-CT more in the past?
Right. So very few centers actually have PET-CT technology. Most, if they use nuclear medicine type studies, it's a SPECT. So single photon emission, computed tomography. But here at Intermountain, we actually have the benefit of having one PET-CT, and actually we'll be bringing on a second PET-CT for the purpose of doing stress testing. It's just the application is very good, much better imaging, a lot more data, but not many centers have it.
Well, this is very exciting. Thank you so much for explaining some of this to us. And we invite you to stop by the Intermountain Medical Center Heart Institute booth in the exhibit hall at ACC 18. And we invite you to spend some time talking to Viet about some further details of the study. Thank you so much, and have a great day.
Thanks.